Well, good morning, everyone. Welcome to this month's edition of What's Your Plan? So my name is Steve Lorberbaum. I'm the owner of Assisting Hands Home Care. And along with Patricia DeBroof, who is our marketing and everything else guru, we each month present an important topic that we think would be helpful in the aging population. It's resources, it's other information. It's in addition to what we do, where we provide aids in people's homes. But this particular month, we're going to talk about how a certain group of people can get funds to help pay for the care we provide. So we're delighted to have Jules Zabarte from the Arc of Montgomery County, who's going to speak with us today. So Jules, welcome.
Good morning, Steve. Good morning, Patricia. Thanks so much for having me here today.
Yeah, so Jules, first and foremost, the ARC is a large organization that does lots of things. So just, if you don't mind, give us a quick overview of the many services that ARC provides, and then we'll sort of dig into what your particular area is.
Sure. I'd love to talk about what the ARC does. And we do many, many different things. First thing is that we have a all-inclusive before and after care program that's located in Silver Spring, Maryland. It's an inclusive environment for children with and without disabilities. Also in the Silver Spring, Kensington area, we have a thrift store. It's called Urban Thrift. And I encourage everybody to visit. Richard is the manager down there, and he's got a lot of good stuff for sale at very reasonable prices. We also have an adult inclusive services where we support adults with intellectual disabilities, and that could be in one of our 35 group homes throughout Montgomery County. It can be in the individual's home, and it could be in an employment and day setting. So we have about 150 people in our employment and day setting. Probably around 100 in our families that are living with their parents or living independently with some staff support. And then there's probably about 100 of those folks. So we're supporting over 500 people totally in all those adult inclusive services. And then we have Respite. So the Arc of Montgomery County has been awarded the contract from the Department of Health and Human Services to administer and coordinate the system of Respite. So what's Respite? Respite is designed to give the full-time live-in unpaid primary caregiver a break. It's not designed for long-term care, but it is designed to give a caregiver a break. Now, we support more seniors than any other population, but we focus on 4 specific populations, and they are children with challenging behavior, children with and adults with functional disabilities such as MS, lupus, diabetes, and children and adults with intellectual disabilities. And again, our biggest population we serve are seniors. And the best thing about this program for seniors is there is no income requirement. And
well, let me interrupt you there for a second to set the table a little bit, because the reason I know Jules is because we provide home care to people in their homes, right? So that's what Assisting Hands does. We work all over Montgomery County, and we work with couples, we work with individuals, and we provide help to those in need. And oftentimes folks struggle to pay for our services. It's not an inexpensive service, but it's very important. And so ARC and Jules provide a great program because they help subsidize the care we provide in people's homes. So Jules, give us an idea of who is eligible to get support from ARC, in terms of their age, finances, that sort of stuff, because not every family that we serve is eligible to receive ARC respite support.
Sure. The most important thing is there has to be a primary caregiver residing in the same household as an individual with one of those 4 target populations we just spoke about. So, for example, you may have a spouse caring for a spouse in the same resident, a parent caring for a child with a disability, a sibling caring for a sibling with MS. We have several grandparents who are caring for their grandchildren with a intellectual disability. So that's just an example of the people we serve in Montgomery County. They're all caregivers. We have partners who are caring for partners.
So if you live alone,
No,
this program isn't for you.
That's right. Unfortunately, it's not. Now, we do try to connect those people with some other kind of services. Montgomery County has probably a lot of great resources for seniors. But living alone, unfortunately,
Okay.
You're not eligible, because there always has to be a primary caregiver, because that is really what the service is for, to give them a break.
So it's a break for that person. It's less about the client, not that they don't need help, but it's about giving the caregiver a break by bringing in a professional caregiver to give them an opportunity to go out to the store, go have lunch, get their hair done, whatever it is they want to go do.
That's exactly what the purpose is for.
And for the senior population, is there an age limit that you have to be over a certain age as the caregiver, or as the client, or as for us, the client, the person needing care?
The age for senior is 60. So if you're a caregiver that is 60 years old or older, or if you're a recipient that is younger than 60 but caring for someone that's over 60, you can apply.
Okay, so if I bring my mom who lived in Georgia and she's going to move in with me, but I'm 50 and she's 80. I'm not 50, but if this is a hypothetical, and she's 80, as long as she was living with me and could establish that she lives with me, then that would be a qualifying use of the funds. Okay, gotcha.
Yeah, and that's a good point to bring up. That is one requirement we cannot forego. You have to demonstrate that the primary caregiver and the individual being cared for must reside in the same household 12 months out of the year. And they need to prove that with an ID, a driver's license, or a Social Security award letter, or a Maryland tax statement. So that's key. We cannot, we must demonstrate that to our county auditors. So
okay, so if someone's coming for to spend a month for vacation, that doesn't qualify them. They've got to actually be both people have to be a resident living in that home.
Yeah.
Okay.
That's the most important thing, and that's really the only requirement, unless you receive some kind of Medicaid waiver, or if you're receiving some kind of other form of paid funding for caregiving. For example, the VA has a program for caregivers. So if you're receiving some other kind of funding source, you may not be eligible for respite.
Gotcha. Okay. So basically, it's simple. The
Pretty
person
much.
receiving care has got to be over the age of 65. There have
60.
to be over 60 rather.
Right.
2 people have to be living together in the home. And they have to fill out an application.
Right. That's it.
Okay. Pretty darn simple.
Yeah.
And so what's the benefit? What do they receive from working once they get approved through ARC? What do they get?
Well, the first thing is that you need to fill out an application, which is on our website. But as you know, we have had an overwhelming amount of applications, so we had to stop taking applications because our funding is limited, and we're getting ready for our renewal season, which means that everybody already enrolled in the program has to renew their application. So we focus on getting them renewed for the new fiscal year. But once you're approved for respite, you'll get a phone call from me, and I provide the family an orientation. about the guidelines of the program to make sure that they understand what the guidelines are, what their eligibility is, and what kind of services to expect. So we tell all the families that respite, the ARC does not provide respite itself, the direct care, but we have a large consortium of home health care agencies, respite facilities, adult medical day programs, and therapeutic programs that they can use their respite hours at these settings. And Assisting Hands is on our consortium and have been for many, many years. So after I have the orientation or during the orientation, I assess the needs of the families. There may be a need for a caregiver that speaks another language. There may be a need for a caregiver who has specific skills in, for example, Hoyer lifting. So there may be a need for a male caregiver, which, as you know, Steve, can be challenging to find. So I kind of connect them with an agency that can meet their needs. And typically we do this orientation in person, but since COVID-19, we're doing it over the phone. So we will connect them with an agency like Assisting Hands. And if the family says, yes, I'd like to work with Assisting Hands, then what we do is start sending the authorization form over each month, approving hours. And they'll continue to use their hours until they have exhausted all their respite hours. So families are eligible for 140 hours in a fiscal year. So our fiscal year starts in July and ends in June. So depending on how the family uses their hours, will determine how long they will have respite hours for.
Gotcha.
Many families will use 40 hours in July, 40 hours in August, 40 hours in September, and then they'll have 20 hours left for October. They want to use their hours, and then many of them will just pay out of pocket or wait till the next fiscal year.
Gotcha. Okay. And so if I recall, you got an approval to increase the reimbursement amount, so that now the reimbursement amount as of April 1 went up to $26 an hour. Is that correct?
Yes, that is correct. I'm always in touch with our consortium members, and I knew that it's been a struggle with COVID-19 to get caregivers. It's costing the agencies a lot more money to find caregivers, to attract them to their organization. And I saw there was a need, and I advocated for an increase. And as you know, for the last 5 years, the minimum wage has been going up, and it impacts our home healthcare agencies a lot.
No, and we appreciate it. So,
yeah. So,
all right. So, to give an example, if we charge between $28 and $30 an hour, you're going to reimburse $26 an hour. So the client, for those 40 hours in that month, are effectively only paying $4 an hour, $3 an hour for the cost of care.
Right. That's exactly correct. So it's a big
Huge.
It's a big cost saving for the families. And the family will determine what agency they want to work with, as long as they're on our consortium. So, there's, I think, 170 home health care agencies in Montgomery County. We don't work with all of them. In fact, we have quite a large consortium. It used to be that I'd have to go out and recruit people beyond the consortium. Now I'm getting phone calls weekly. I need to join your consortium. So, but we just don't take anybody. Sometimes a family has been using an agency, and if they can meet our requirements, we'll onboard them. But
Gotcha.
We do have a lot of senior providers on our consortium.
Gotcha. All right, great. So I know you said that at the moment you all have stopped taking applications. So is it that when the new fiscal year starts, July 1, that's when you'll open up for applications again?
Well, actually, we're going to open up applications on July 6th. One of the reasons is we always don't get our funding on July 1st. So I can't really approve hours for the new fiscal year until I get that purchase order in my hand.
Gotcha.
So to proceed with approving hours. So, and that information is on our website. So it's always good for families to check our website, periodically to find the latest and greatest news about our program. We were going to initially stop taking applications April 30th, but we were just got so many, we knew that we were not going to be able to support the family. Because of the funding is limited, so.
Gotcha. And it's not that I want to set the bar high for you. You have worked absolute miracles in getting people approved. I mean, there are times when I feel like they've made a phone call and an hour later I'm getting the authorization if they've submitted all the stuff. But what's the realistic time frame that someone should expect from the time they submit the application that they can get funding?
Well, really, we say 30 days, but it usually doesn't. But like if we're having we're doing billing, it slows down things. So it's basically, sometimes we may get one application in a week. Other times we could get 20 applications. So it really depends on the time of year. And it also depends, we get a lot of referrals from adult protective services. So those are bumped up as a critical need. And we get child welfare cases that come to our office. So those are our priority. We also support many families that are enrolled in the hospice program. So we try to expedite those, but we've been so busy lately, haven't been able to turn them around as quickly as we'd like, but we do our best. But we're very thorough about getting all the information. So if you don't, there's a checklist on that application. So we really ask families to look at that, review it before submitting it, because if we don't have everything we need, we will not process your application. You'll get a notification, and we'll work with you to get the information that we need to process your application. It's been challenging for seniors because many of them do not use technology, but we've been working with them. Sometimes we'll have to take an application over the phone and work with a caseworker, if there's a caseworker assigned, to walking them through it. But many of our consortium members, such as you, Steve, will help families. They may already be connected with you using them. And Steve, you're doing an awesome job in referring all of your clients who are eligible for respite to our program. So from a business perspective, you're really helping these families out, and it's a win-win situation for everyone. And families, so many families will call me and say, hey, I didn't know about this program and Steve told me about it. I'm like, well, that's great. We look to our consortium members to refer them to our organization because we want to help as many seniors as possible. As you said, caregiving is a demanding job and it's expensive. So when families can hear they have a subsidy for care, it's just great news to them and they feel a sense of relief. So we're always looking for our consortium members to refer families to us.
Well, good. And I know I have gone out to people's houses and helped them fill out applications and brought them back and scanned them so I could get them into you. We really appreciate that because it's been tough for seniors even to get out at all, feeling comfortable getting out, and scanning and faxing, they don't have the ability to do that. So we rely on our consortium members to help them out. And it's been very beneficial this past year. And it seems to me that, the application is really pretty easy. I've been through it. And the only thing that really is challenging is that you've got to get a doctor to fill out a form.
Right. Right, that's the physician help form. And part of that is to, when we put that physician help form together, we asked a group of nurses to help us with that. But we always have this problem with physicians thinking that an aide needs skill, a family member needs skilled nursing when they really don't. They need assistance with activities of daily living, preparing a light meal, engaging in a conversation or an activity with the senior. So we're looking to change that to help families out and the doctors out. So it has been a little challenging, but we're always looking at ways to make things easier for families. We're trying to figure out a way that we can help seniors get that physician help form. I've heard from so many seniors that their doctor's offices are not calling them back. But these are very challenging time for physicians, anybody in the healthcare. So they're just swamped. And so we're trying to do our best to help them out. And we even sometimes, if a family has been in your program for many years, if the nurse feels comfortable and you've had a relationship with them, we'll ask them to sign off for it. We had that problem recently where a very senior couple, very elderly, just could not get her doctor to sign this form. So we were trying desperately to get them help. He just came out of the hospital. So we can get creative, and we do our best to help everyone.
Well, good. Well, I know, for us, we find that the people that need your support the most are our clients that where the primary caregiver is just exhausted, right? They haven't left the house enough because of COVID in particular. They're caring for their loved one. It's tiring. They don't feel that they can leave their loved one alone, even for a few minutes. So getting approved for respite so that they can even go to the grocery store, get their drugs at the pharmacy, take a walk on the canal. All of those things are just, it's the blessing that you all help provide. So we can be there caring for their loved one and making sure that they're being kept company and safe, having a meal. A lot of it is not high-end complicated care. It's just giving someone a break so they can go recharge themselves, because being a caregiver is exhausting.
Yeah, many times I'll speak to a family, and so I'll say to them, so what do you see yourself doing with this time for yourself? And I always hear this pause, and they often say, I haven't done anything for myself for years, and I've really never thought about. So then I'll ask them, so what do you like to do? So often I hear that many caregivers don't have the opportunity to go to their services on the weekends, whether it's Saturday or Sunday. They would enjoy the company of others that in their religious community, and missing out on their service was a big part of their life, and they really miss that. So many times families will use their respite hours so they can go to service on Saturday and Sunday, and then maybe afterwards they'll have brunch or lunch with friends in their community, and they might take a few hours for themselves to go to the library or do some shopping. And then we have seniors that they don't leave their house, but they sleep. Right. They just need to sleep. And they know someone's with their spouse or their sibling, and they just sleep. As you know, many seniors with Alzheimer's are up in the middle of the night and keeping their caregiver up as well. So they just need time to sleep. And they love that. I want to take a 4-hour nap. And that's great. Or they don't have the opportunity just to read. So many of them I've talked to used to belong to book clubs. They don't have that opportunity. because they're constantly caring for their loved ones. So it's people use it for various reasons.
Gotcha. So I don't know if we're drawing to a close, Patricia. I don't know if anyone posted any questions or if anyone has any questions for Jules or for me for that matter. Please feel free to ask away. All right. Well, it seems that you've done an exhaustive job, Jules, in making it pretty clear how you can get involved with the program. Again, go out to the ARC website. It's Arc of Montgomery County. It's got great information and it's got the application that you can print out and make available. If you need a combo and you can work with both Jules and I simultaneously, which is fabulous, or Patricia.
Yep,
so
exactly.
You can always give Patricia a call and she can help you started on the process of getting support for someone you know or a friend. And then when ARC opens back up, and I'll bet, but I'm not going to say publicly, that there must be, maybe I am saying publicly, that there's some secret stash that Jules is hiding for those truly in need. Now, I don't know for sure, but I think that, yeah.
We do our best. I mean, we are now serving 658
wow.
People. Our youngest person being served is 6 months, and our oldest is 107. We have 20 seniors that are over 100 years old in Montgomery County. That's in our program, enrolled in our program.
That's amazing.
90-year-olds taking care of 90-year-olds.
There's been
I know that's the thing. Go ahead, Patricia.
I was just going to say there's been a bunch of thank yous on the chat. Just so you know, everybody's thrilled to know that the ARC Montgomery County is alive and thriving. And one of the questions that came up was just how can other folks who don't need respite care or these services help the ARC? I know you're a 501c3. Is there a fundraising thing coming up? Do you have any announcement you want to make to people before we shut down?
If you go to our website, there's a upcoming fundraiser, Coffee and Conversation. We're looking for sponsors. This has been a difficult year for all nonprofits, including the ARC. At the beginning of the pandemic, we just didn't have enough PPEs for our staff that support our adults with intellectual disabilities. Our after-all program, before and after care for children, was definitely impacted by COVID-19. So there's always a room to make a donation. We welcome them all the time because we are a nonprofit. And we're always looking for generous donations from our community in Montgomery County. We thrive because of donations, and we can continue to help support people with and without disabilities. So donations are always welcome and appreciated.
Great. Well, Jules, thanks again for joining. This has been really helpful and really appreciate you taking the time. I know you've got probably 50 calls in the half hour you've been online with us. So
I shut that phone off for 30 minutes.
Good. So next month we have Kay Lowry. She's a nutritionist who is really going to help us as well get on the path of eating better as opposed to eating a lot, which is what I've been doing during the pandemic. And now it's time for me to eat healthy again and get back out. It's swimsuit season for all of us. Yeah. So in any event, have a great rest of the week and weekend. And Jules, again, thanks so much. Patricia, thanks as always for your help.
Thank you. Take care.
Thank you,
Bye-bye.
Jules. Bye.
Alrighty, take care. Thank you. Bye-bye.